connections between the hip and the pelvic floor because it can be such a big piece of the puzzle for so many people. But before we do, I want to point out that we have been talking about stress management for, the last 3 weeks or so, that the holiday season can be super stressful for a lot of reasons for a lot of people, but there are very simple, no cost, no equipment needed techniques, breathing, that you can make use of to really be able to manage your stress. And every so often I've been pulling you guys, are you stressed out? Are you trying to manage it? And for the first time, my poll yesterday started to show that those numbers are really tipping to where there are not more people managing it than not managing it, but it's trending the right direction. So maybe it's a change in who's answering the poll versus an actual change in our behaviors, but we can always hope, and we'll keep talking about it at least through the holiday season, because stress management is such a big deal in keeping your system from getting ramped up into that fight or flight response all the time that causes us to carry increased muscle tension throughout our body that contributes to all these problems. But let's get to the hip and pelvic floor. So a little background on me. I worked in outpatient orthopedics as a physical therapist for 12 years before my kids were born. And I saw lots of patients with hip pain, and I worked with great physical therapists, and I took a lot of continuing educations from other really great physical therapists. And I can tell you, never once did I have a pelvic floor conversation with the people that I was seeing with hip pain. Never once did any of my coworkers say, hey, maybe you should consider this person's pelvic floor, or I had this great experience with this patient by talking about their pelvic floor. Never once did I go to a continuing education where the instructor was like, what do you understand about your pelvic floor function, or what do you understand about your patient's pelvic floor function? So to say that it is undervalued is the understatement of the year. This is almost not considered unless you're speaking to someone who has pelvic floor experience for whatever reason. So for me personally, it took having kids before that was on my radar, before that was part of the conversation. And so now I am trying to bring those conversations to you at whatever stage in life you might be, so that you can see how much the pelvic floor is part of the hip conversation and how much the hip is part of the pelvic floor conversation. So it really goes both ways. When we have pelvic floor issues that don't seem to solve by looking at the pelvic floor, then we need to consider the hip mobility and strength. And vice versa. When we have hip issues that don't seem to resolve by treating the hip, we need to consider the pelvic floor, because those groups of muscles, all of these divisions are arbitrary. Your brain does not necessarily think, I'm going to do this with a hip muscle versus I'm going to do this with a pelvic floor muscle. All of that has to work together in combination with your breathing, your abs, your feet, etc. All of it works together to accomplish the movement. And your brain considers it more as the goal of the movement versus the isolated body part. So we need those to work together. And earlier this week, I shared a post about when people say Kegels don't work for me. Well, exactly what do they mean when they say that? Because there are so many aspects of pelvic floor function that could be considered a Kegel, or it could be considered a normal pelvic floor function. So before you decide that your pelvic floor isn't part of the equation, how do you answer all of these questions? Because if you're having hip issues and you can't answer yes to all of the questions in that previous reel, then we have not exhausted your pelvic floor as a factor in your hip issues. And when you feel like, you've done the massage and you've done the stretching, how well does your hip work with your pelvic floor? How healthy is your pelvic floor function? Is it effective in a way that's working for your body? Are your pelvic floor and your hip working together? Because so often the pelvic floor is a factor in hip pain. And so hopefully this gives you some things to think about if you're somebody who is struggling with chronic hip pain. And I have another post coming for you in a couple of days about ideas for imbalances to consider consider in your hip when your pelvic floor is part of the issue. So stay tuned for that one.